Kidney problems often develop quietly. Long before serious symptoms appear, your body may begin sending subtle warning signs that are easy to overlook. While these signs can have many possible causes, recognizing them early may help you know when it's time to seek medical advice. Let's explore 7 important signs everyone should know. One of the earliest changes some people notice involves urination. You may find yourself going more often, less often, or waking several times during the night to use the bathroom. These changes do not automatically mean kidney disease, but they can be worth discussing with your healthcare professional, especially if they persist. You might also notice that your urine looks different than usual. Changes in color, foaminess, or the amount of urine produced can have many possible explanations, including hydration, medications, or certain medical conditions. Persistent changes deserve professional evaluation rather than self-diagnosis. Doctors often consider urination changes together with other symptoms and laboratory tests. That's because urination alone rarely provides enough information to determine the underlying cause. Looking at the complete picture helps healthcare professionals decide whether additional kidney testing may be appropriate. Urination changes may be the first clue, but they're not the only one. Another early sign can appear in a place most people never think to look: their feet and ankles. Healthy kidneys help maintain the body's fluid balance. When kidney function is affected, some people may notice swelling in their feet, ankles, or lower legs. However, swelling has many possible causes, including heart conditions, vein problems, certain medications, or standing for long periods, so it should never be used to diagnose kidney disease by itself. Swelling can happen because excess fluid collects in body tissues. If the kidneys are not maintaining fluid balance as efficiently as expected, fluid may gradually build up. But doctors also consider many other possible explanations before deciding whether the kidneys are involved, which is why a proper medical evaluation is important. If swelling appears suddenly, becomes severe, or is accompanied by symptoms such as shortness of breath, chest pain, or rapidly worsening health, prompt medical assessment is important. Persistent swelling together with abnormal kidney blood or urine tests may provide additional information that helps your healthcare professional determine the next appropriate steps. The next warning sign doesn't appear on the outside of your body. Instead, it's something many people simply blame on getting older: constant tiredness. Do you feel exhausted even after getting a full night's sleep? Persistent fatigue can have many possible causes, including stress, poor sleep, anemia, thyroid conditions, or other medical problems. In some people, reduced kidney function may also contribute, which is why ongoing unexplained tiredness deserves proper medical evaluation instead of being ignored. Healthy kidneys help maintain several important functions in the body, including supporting the production of hormones involved in making red blood cells. If kidney disease becomes advanced, anemia may develop in some people, which can contribute to weakness and reduced energy. However, only proper medical testing can determine the actual cause. Doctors rarely rely on tiredness alone when evaluating kidney health. Instead, they combine your symptoms with blood tests, urine tests, blood pressure measurements, and your overall medical history. Looking at all of these pieces together helps them determine whether your kidneys or something entirely different may be contributing to your symptoms. Feeling tired is common, but the next warning sign can be much easier to overlook because it often happens while you're simply trying to enjoy a meal. Have you recently noticed that food just doesn't seem as appealing as it used to? A persistent loss of appetite or ongoing nausea can have many possible causes, including digestive problems, infections, medications, or other medical conditions. In some cases, advanced kidney disease may also contribute, making professional evaluation important if these symptoms continue. When the kidneys are no longer filtering waste effectively over time, certain waste products may gradually build up in the bloodstream. In more advanced kidney disease, this can sometimes contribute to symptoms such as nausea, changes in taste, or reduced appetite. However, these symptoms are not specific to kidney disease and always require proper medical assessment. Because appetite changes and nausea are common symptoms with many possible explanations, doctors rarely rely on them alone. Instead, they combine these symptoms with blood tests, urine tests, physical examination, and your medical history before determining whether your kidneys may be involved or whether another condition is more likely. The next warning sign doesn't affect your stomach, it affects your skin, and many people never realize it could sometimes be linked to kidney health. Does your skin feel constantly itchy, even though it doesn't seem unusually dry? Persistent itching can have many possible causes, including allergies, eczema, liver conditions, diabetes, or certain medications. In some people with advanced kidney disease, changes in the body's internal balance may also contribute, making ongoing symptoms worth discussing with a healthcare professional. When kidney disease becomes more advanced, the balance of minerals and waste products in the blood may change. These changes are thought to contribute to itching in some people. However, because itching is extremely common and has many possible explanations, doctors never rely on this symptom alone to evaluate kidney health. If persistent itching develops together with abnormal kidney blood tests, urine changes, swelling, or ongoing fatigue, your healthcare professional may recommend additional evaluation. Looking at several symptoms together provides much more useful information than focusing on any single symptom by itself. The sixth warning sign doesn't appear on your skin or in your stomach. Instead, it may show up every time you try to focus, remember something, or think clearly. Have you been forgetting simple things or finding it harder to concentrate than usual? Difficulty focusing, memory lapses, or what many people call brain fog can have many possible causes, including poor sleep, stress, depression, vitamin deficiencies, medications, or other medical conditions. In advanced kidney disease, these symptoms may also occur in some individuals. When kidney disease becomes severe, waste products that would normally be removed from the blood can accumulate. In advanced cases, this may affect how clearly a person thinks or concentrates. However, because brain fog is common and has many possible explanations, proper medical evaluation is always needed to identify the actual cause. Doctors never diagnose kidney disease based on memory problems or poor concentration alone. Instead, they consider your symptoms together with blood tests, urine tests, physical examination, medications, and overall health. Looking at the complete clinical picture helps identify whether the kidneys or another condition entirely may be contributing to these changes. The final warning sign may be one of the easiest to ignore because many people simply blame it on getting older. But when it appears together with several of the signs we've discussed, it's worth paying attention. High blood pressure and kidney health are closely connected. Healthy kidneys help regulate blood pressure, while persistently high blood pressure can gradually damage the delicate blood vessels inside the kidneys. Because of this two-way relationship, blood pressure is one of the most important measurements doctors monitor when evaluating kidney health. Over time, persistently elevated blood pressure may place extra strain on the tiny blood vessels that supply the kidneys. If these vessels become damaged, the kidneys may gradually become less efficient at filtering blood. At the same time, reduced kidney function may also make blood pressure more difficult to control in some individuals. If your blood pressure remains higher than recommended despite treatment, or if it's accompanied by swelling, changes in urination, fatigue, or abnormal kidney blood tests, your healthcare professional may recommend further kidney evaluation. Regular blood pressure checks, healthy lifestyle habits, and appropriate medical care can play an important role in supporting long-term kidney health. Many of these warning signs can have causes other than kidney disease, but ignoring persistent symptoms is never a good idea. If you've noticed several of these changes, or if your blood or urine tests have been abnormal, consider discussing them with a qualified healthcare professional. If you found this video helpful, subscribe to VitalBites for more evidence-based health education and practical wellness tips. This video is intended for educational purposes only and does not diagnose, treat, or replace professional medical advice. Symptoms discussed in this video can have many possible causes. If you have persistent symptoms, abnormal kidney test results, or concerns about your health, consult a qualified healthcare professional for an individual assessment.